symptoms of atrial fibrillation can be very pronounced, and they can also be very subtle. The more pronounced symptoms that people get from atrial fibrillation are palpitations, chest pressure, shortness of breath, passing out or almost passing out, or just feeling awful. But some patients don't recognize the symptoms of atrial fibrillation. They just say, I just feel a little more tired. I just feel a little more weak. Maybe I'm just getting older, but I just feel like I aged over the past year. The thing is, you don't age quickly and drastically. You age gradually. This is your normal heart. Blood is coming in from the head and neck and from your body into the right upper chamber. Then it goes and gets squeezed to the right lower chamber, gets squeezed up to your lungs, and comes back from your lungs into the left upper chamber through these pulmonary veins. Goes through into the left lower chamber and gets squeezed out the aorta to the rest of the body. The natural pacemaker is up here. It tells your heart rate to go faster when you walk and slower when you rest. It fires. Electricity goes through both upper chambers and they squeeze. Then electricity passes through this connector, through these wires in the lower chambers, and they squeeze. So everything is synchronized. Atrial fibrillation is when the left upper chamber gets erratic. These veins, called pulmonary veins that bring blood in from the lungs, start to fire. They then cause an arrhythmia in the left upper chamber that spreads to the right upper chamber, and they beat very fast and erratically at 600 beats a minute. Your heart rate depends on how many of these beats get through this connector, the AV node, through to the bottom chambers. The heart beats fast and erratic, as this is a gatekeeper, but only so much so. The whole heart is beating out of sync because of this arrhythmia going through to the bottom chambers and making it beat erratically.
During the ablation procedure, the patient is sedated by anesthesia. We enter the veins in the groins of the leg, called femoral veins, on both sides with catheters up into the heart. There's also an ultrasound probe sitting in the heart, and under ultrasound guidance we cross from the right upper chamber to the left upper chamber with the catheter, and then we insert catheters into all four pulmonary veins to detect the abnormal signals. We also move this catheter around, that is like a circle, all around the left upper chamber to detect how much scar tissue there is. Once in position, we will insert the cryoballoon. We'll inflate it outside the vein. Make sure the vein is occluded by injecting contrast and also under ultrasound guidance, and when it looks good, we will freeze. We'll freeze the outside of the veins for 3 minutes at a time, usually repeated again, and make sure there are no signals that enter from the left upper chamber into the pulmonary vein or that exit from the pulmonary vein into the left upper chamber. Once all four pulmonary veins are isolated, then that procedure is over. In cases where there's more significant chronic or persistent atrial fibrillation, we are involved in a new process called rotor mapping.